And also, certain racial and ethnic groups have higher STD rates than Caucasians. And this is mainly because of poverty and being in social networks that connect you that have higher risk behaviors. Um, if you're poor or underemployed or have poor access to healthcare, um, you it's been proven that it's more likely to make you STD. For example, among women, 18% of syphilis cases, 30% of gonorrhea cases, and 46% of chlamydia cases in North Carolina were reported among African Americans. And this is the highest percent among any racial or ethnic group in the state. And since young minority women are at risk of contracting STDs the most, teenage girls need to know what they need, and they really do need comprehensive sex education that's abstinence plus if you decide that what you do to protect yourself. They need a parent or a guardian or some sort of trusted adult that they can communicate with about sexuality and healthy relationships. And they need encouragement to make responsible decisions about their sexual health, and they need better access to sexual health services.
Good morning. You're going to hear me, and I don't need to stand back there. And I move, so I'll stand up here. I'm Carrie Vanderwerken, and I'm the Health Center Manager at the Charlotte Planned Parenthood Clinic. And I've only been there about 6 months, but prior to that, I worked for Planned Parenthood in upstate New York for 14 years. So when we were planning our move to Charlotte, I was very excited to be able to say to Planned Parenthood. And I absolutely love the Charlotte Clinic. So I'm really proud to work there. It's a great clinic with great staff, and doing a lot of good things for this community. If you can help us, get the word out about what we do. Just want to ask you real quick, what do we do? Give me an idea. What do we do at Planned Parenthood? Give me one word, one service. Okay, information and education. What else? Okay, yes, we do give Gardasil, we give TB vaccine, and different stuff. Yes, what else?
Actually, you keep safety.
Okay, safety and prevention. What about medical service? What do we do? No. What the heck do they do there? Yeah.
Is that called a one-natural pill?
Yes, it is. We do give out emergency contraception, which is the morning after pill, and actually a person can take it up to 5 days after unprotected sex, whether it be from a rape or a condom breaking or whatever the situation or scenario was. Yep, we do. What else? I know you know. What else? We do the full range of reproductive health care. We do annual exams, well exams, including a pap smear, a pelvic exam, a breast exam. We screen for cancer. We screen for cancer. That's done through breast exam for breast and through pap smear for the cervix. So we do annual exams. We do birth control, all prescription and non-prescription forms of birth control. We educate about them, and we actually dispense them there at a lower cost than pharmacies cost. We test and treat for sexually transmitted diseases, including HIV. We do confidential, rapid HIV testing. We do pregnancy tests and referrals, giving out information, no matter what choice a person is making. We give out adoption information, we give out prenatal care information, or we would give out abortion referrals. We also see male guys to do sexually transmitted infection testing and treatment. I think what sets Planned Parenthood apart from other healthcare organizations or providers is our commitment to an excellence in educating women, in particular, but males too, when they come, about their bodies, how they work, and sexual health. We don't just take somebody in and diagnose a problem and give them a pill and send them out. It's all about educating people about their bodies and how they work and prevention. And I really think we do it best. Unfortunately, we don't provide free services here in North Carolina, and that is because we don't have the government funding to be able to do that. Other states do, but we don't. So we have to charge for our services. We do accept insurances, Medicaid, and then we do a self-pay program for those who don't have any health insurance of any kind. And it's a discounted rate for our services. It turns out to be about half of what you would pay in the private healthcare. We call it a prompt pay discount. You do have to pay at the time of services, but it's about half of what you would pay us. That prompt pay discount is not based on your income or your family size, so it's not the same as sliding fee. But anybody who doesn't have insurance gets that same discount. You don't have to prove to us your income or your family size. We do a lot of referrals. We refer all the time, and particularly for people, let's say, that need FTD testing and can't afford to pay even our discounted rate. We would refer to the health department so they can do that for free. So we try to get people the care they need, and if it can't be with us, with other people. Talk for just a minute about the latest innovations in family planning. And one of the things that we're doing at Planned Parenthood, which just makes it a little easier and a little more affordable to access birth control, is called a HOPE visit. And HOPE stands for hormonal contraception, omitting a physical exam. So it used to be if you wanted to get on the birth control pill, which is hormonal contraception, you had to have an annual exam with a pap smear before they give you a prescription. Well, that's costly. Us, at our discounted rate, is $120, right? So a lot of people had to put off birth control because they couldn't afford the annual exam to get the birth control. And what we found, what research showed us, is they don't need to go hand in hand. You really could start to take birth control without getting a pap smear. Still recommended to have pap smears, certainly, but you don't need to have one to go on birth control. So these HOPE visits are a consultation visit at Planned Parenthood. You don't get a physical exam, a pelvic exam, a pap smear. You get a consultation about all the types of birth control. You get educated about how to use what you're choosing. We do a weight and a blood pressure check to make sure you're healthy, and then you get the prescription for a year of birth control. That costs about half of having to have the annual exam before you get birth control. So lots of people are doing that. Not a whole lot new in the hormonal birth control. We have a new method called Implanon, which is a long-lasting 3-year method, little flexible rod that gets inserted in the inner upper arm. Used to be Norplant. If anybody heard of Norplant years ago, that was 5 rods, and that's no longer available. Implanon is 1 rod that's inserted here and stays in for up to 3 years. You can get taken out whenever you want. and is highly effective, 98 point something or 99% effective at preventing